a lot about assessment and intake strategies, and I'm hoping that people will have questions because I think it's important when you're looking at assessment and intake to make sure that everything fits together. If you have somebody doing an assessment and it doesn't address the issues that they talked about in the early part of their paper or the early part of their proposal, or if their outreach is not the same, they're not looking for those people that they are trying to get, then you got some issues. So as soon as I have some control, we can go ahead and start going through these slides and get through them and hopefully get some questions in and make sure you have everything you need.
And you should see the controls up at the top of your screen.
Oh, yes. Thank you. Oh, wait, that was me standing there training. And you can't see the audience, but they were really excited. So, oops. I missed the slide. Okay, so when you're doing the assessment, this is when I looked at the paperwork, you could get up to 10 points. And it was important to make sure that in the assessment that they were addressing and talking about veteran skills and knowledge gaps, that they were also looking at those barriers to employment, and these are just a few of the barriers to employment. But they could be anything from the person's abilities, interests, needs, substance abuse, mental health issues. All of those could be barriers to employment that could be addressed or being talked about in the assessment. And also looking at the participants' willingness to enter employment to get the services. So those are some of the things that they're looking at in the assessment and that should be addressed in the assessment. Hold on a second. My computer just froze. All right. So when you're looking at an assessment, some of the veterans that are coming in are going to be struggling with some of these issues. And not all, but some are going to have some issues with soft skills. And everybody, I'm sure, knows the soft skills. And we take for granted sometimes that it's easy to get up and get to work and know how to deal with other people, but sometimes that's an issue. The settings, how to deal with the work settings, basic math, basic reading, following directions, usually not that big of an issue, but I've had, some veterans who had issues with who they wanted to take directions from. So all of these things should be addressed in the assessment. There should be some mention of what type of things they're looking at in the assessment, what types of issues that they're going to help the veterans deal with or that they're going to focus on. The documentation. In the assessment, that's where they're going to be documenting the eligibility criteria for the veterans that they're serving. Are they serving, I'm sure they're serving veterans, but are they serving homeless veterans? What are they taking in as the proof of homelessness? Are they going to be looking at job readiness training or getting people prepared for employment? Are there things that are included in the documentation for the intake form? So does the intake form and the assessment go together? All of these things also have to be done with outreach. So if they're serving homeless people, the outreach should be out there trying to find those same homeless people that they're going to work with and that they're going to have the proof that they're homeless.
So just to ask and check in with folks in terms of the homeless definition, we're using the McKinney-Vento as modified by the Hearth Act definition, right? And that's literal homeless or at risk for homelessness. Everybody on board with that? or any questions about the definition.
I'm going to take silence as no question. So people are clear about that.
I have one comment.
Yes.
You may have some organizations that are focusing on using HUD-VASH vouchers. And in that case, the veteran needs to be housed, if they're using a HUD-VASH voucher, after the date of enrollment. So if the veteran comes to the program already enrolled in HVRP, already with a voucher that's fully executed, then the veteran is not eligible for HVRP services. However, if the voucher is executed after the date of enrollment, then the veteran is eligible for HVRP services. Now, what we've said in the SGA is that organizations should strategically think about how they would do enrollments when they're utilizing HUD-VASH vouchers. And you may see some strategies in the SGA that make sense. You may see some, I didn't mean to say SGA, in the applications that make sense, and there may be others that don't make sense. You'll have to rely on your expertise to determine whether or not that strategy is a viable one. But it's certainly one that you should be sensitive to. That's just my comment. Thanks.
Thank you. Good comment. Anybody else have questions or comments? Okay. So what you see up on your screen is some of the tools that some of the agencies or some of the programs might be using. My Next Move, which you may know is a resource that can be mentioned in an application as a tool that is used to help people or help veterans explore careers, or also to translate their military occupations to civilian job titles. Of course, there are other translators, too, that a grantee might mention. Wells Fargo, for example, is another one that some grantees might be using. The ONET Interest Profiler, that's a tool that can help you find out what your interests are and how they relate to the world of work. So you can find out, on this tool what you like to do. So some programs will be working with their vets using that tool. The ONET Interest Profile also helps you to decide what kinds of careers you might want to explore. And that profiler is available at the My Next Move website. The TAPE test is it's a test of adult basic education. So it's a comprehensive academic assessment product in adult basic education. It's commonly known and used to provide a solid foundation for effectively assessing the skill set and knowledge of adult learners. So a few HVRP applicants are probably going to use the TAPE testing, but it's not a common tool. But some might be using that tool to see where the people are as far as their adult education. There are still a lot of other tests out there that are used in employment programs. There's a self-directed search is one example. Although a lot of the HVRP shy away from paper and pencil or computer-based testing, the presence of these things in an application would be indicative of an applicant with knowledge of the tools. So sometimes it's a good tool to use when and it depends on what they're trying to do, but it should make sense if they're using one of these tests, how they're using it and what they're trying to do with it. But it's a good thing if you see somebody using one of these tests in there and they have it in their application. So the applicants must demonstrate how they will collaborate and coordinate their efforts with the other VAs and other locally based veteran service organizations, the VSOs, to ensure that the participants apply for and receive a multitude of veteran benefits for which they are eligible. So it's making sure that they have some indication of who they're collaborating with, and the VA has to be or should be one of those partners. The applicants must demonstrate how they will collaborate. And they also have to demonstrate how they're going to refer people to the VA to file a claim for compensation or pension benefits as appropriate. As a part of the referral process, the applicants must describe how they will track and assist with the progress of a participant's claim and be able to report the ultimate outcomes related to those efforts within a participant's case management file record. So it's not enough to just refer somebody, but they should have a process for how they're going to track and make sure that everything is going as planned and going as smooth as possible, and that should be part of their assessment and their coordination of services. Am I making sense so far?
Yes.
Thank you. Any questions? Please feel free to jump in if you have questions. Also, as a part of the intake process, an applicant should determine whether or not the veteran is co-enrolled in other community or VA services, as well as which services the veteran could enroll in, as well as the HVRP. And I think this was, we already started this conversation about HUD-VASH, but there are other programs as well. There's the SSVF program. There's the, in mental health treatment could be one, and CWT is another program. GTD, there are tons of programs out there, and it's important to make sure that the veteran is a part of all of the ones that they're eligible for, because one of the things we know is that it's important to not just address one issue at one time, and sometimes a veteran can address multiple issues at the same time, and they affect each other.
Just to be clear again, Pat, just building on what Ken said about VASH, are people familiar with supportive services for veteran families programs in your communities? Has anybody been to visit one, or have talked to any of those programs, or talked with their grantee about SSVF? Is that a no? Not really?
This is Sandy. When I was in New York, a grantee up there that we had, Veterans Outreach Center, I believe had an SSVF grant and an HVRP grant.
Right. This is up in Rochester?
Right. Mm-hmm.
Yeah, they're a good example of an increased number of HVRP grantees that are dual grant holders. So in the applications, obviously they would be talking about that fact that they receive an SSVF grant as well. And these two programs overlap significantly, with roughly almost 40% of the HVRP grants have an SSVF. So it's getting closer to that mark. The last go-round, it was just over 30%. So the VA has invested in that program to prevent homelessness among veterans, as well as to rapidly get people out of homelessness should they fall into it. But given the HVRP eligibility that you cannot be in permanent housing, there has to be close collaboration between the HVRP and SSVF, just like there needs to be with VASH, because once a voucher or assistance is executed and that veteran goes into permanent housing, they would lose their eligibility for HVRP. At least the way the current rules and statutes read, that's what we have to live with. I guess we're learning that as we move forward with ending veteran homelessness, that may not be a best strategy anymore, but nonetheless we're sort of stuck with the statute and the rules as it is. But that aside, just to know that in an application, an applicant should be clear that they have to the veteran has to be homeless in the McKinney definition, not can't be in a permanent housing situation. And SSVF is their goal is to rapidly get a veteran into permanent housing. So the relationship between the two programs has to be very tightly woven together to make sure that the veterans can benefit from employment assistance at HVRP in a timely way. So I just want to build on that and mention that so people are cognizant of that. Sorry, Pat.
Oh, no problem. It feels good to hear somebody else's voice besides mine. All right. So, the important thing that you want to see in applications is how the grantee plans on ensuring long-term success. They need to fully explain how they will design and implement their proposed assessment and intake process. It's important that you be able to look at the design of the process and see how they're going to, what they define as the long-term success and how they're going to maximize it. And this should be for anybody coming into their program. Also, how are they going to, once the grantee identifies a potentially eligible homeless veteran, and they make an assessment of their abilities, needs, their interests, and barriers, how is the assessment going to determine how they're going to get to success, and how are they going to define success for that veteran? Is success getting the job, or is success staying on the job for a certain length of time? Is success by how much the person makes on the job? All of those things should be clear in the assessment.
The assessment should also try to identify any potential training that the veteran might need. So the kind of assessments that the grantee might or an applicant might take up should identify whether it's a particular occupational skills assessment or other kind of knowledge or skill building training that would be useful and appropriate to the veteran securing permanent employment. So whether or not the veteran might be a candidate for HVAC training or an OJT or another kind of strategy that might build their skill set. The kind of assessments that they talk about in the application should reveal something about the training, because as you all know, they're going to need to meet a training goal as part of their HVRP. So assessments should speak to there should be some relatively clear linkage from assessment to training needs.
Thanks, John. In addition to all of this, the applicants should demonstrate how they will determine a potential program that the participant and their willingness to enter the employment arena, followed by the receipt of services. So basically, you want to make sure that they illustrate how they're going to refer people to programs and how they're going to make that determination of who gets referred to what program. So if somebody has a physical rehabilitation need, how are they going to make a referral for that person? And how are they going to deal with drug and alcohol treatment, mental health services, housing? So it should be fairly clear in their proposal how they plan on dealing with those and how are they going to make the referrals and how are they going to follow up those referrals for people who are coming into the program. The other thing that the intake and enrollment should address is assessing people's skills and knowledge gaps, which is what John was referring to earlier, and the types of services that they need to assist the individual. It could be a career technical training, soft skills training, aptitude training, counseling, referrals to other services. All of these things are some of the ways that they should be helping to fill gaps that the veteran comes into the agency with. Uh-oh. So it's important. I think I missed the slide. There you go. We also need to make sure that the agency has cultural competence. And what I mean by that is understanding how veterans, their perception and response to traumatic events, having knowledge of military language, acronyms, paperwork, culture, and experience of military service members and veterans for both men and women. So they should have a good understanding of military culture. A good application also should talk about or have a way of how they're going to promote safety, have a safe place, a safe environment for people to come to that's going to meet people's basic needs, how they're going to have safety measures in place, what's their response by staff going to be for some to make sure that things are consistent, predictable, and respectful to the veteran that comes into their agency. A good applicant also will understand trauma and its impact. How does traumatic stress impact the veteran? They should be able to recognize that many behaviors and responses of traumatized veterans may seem inappropriate or unhealthy in the present, but represent adaptive responses to past traumatic experiences. So they should be very, very clear on that and very clear and adept in handling those types of issues. Any questions thus far on this?
No questions.
All right, thank you. So it's important that a good application that shows how they're going to help veterans regain a sense of control over their daily lives and build up their competences that will strengthen their sense of autonomy. It should help keep the veterans well informed about all options. So the vet has to be in charge of their own plan. It should not be a one-size-fits-all plan. It should be basically what the vet wants and working with that vet to make their own decisions. It's important to screen all veterans for a history of sexual harassment and assault. It's something that is a good practice for programs to do, and it's something that it should be done across the board because it doesn't just happen with women. One of those things when they're sitting there screening people and doing assessments, they should be looking for types of trauma that the person or the veteran has had when they come into the office, and how can they help address those types of issues. So it's going to be one of those important things to make sure that they're taking that into consideration when in their application. Can't emphasize this enough. Agencies can't do everything on their own. A good applicant will have partners, and it's important for them to demonstrate how they will collaborate and coordinate their efforts with the VA and other agencies. It's important that they demonstrate what the collaboration will look like, with who is doing what. So what's their role and what's the role of the other partners? What other partners going to do what? Are there MOUs or memorandums of understanding that they have with other agencies, or what's the collaboration look like? Is it very clear who does what? when they have a collaboration, you want to make sure that they are very clear about their role in the partnership and the role of their partners and who is doing what. It should be very logical when you look at the application, that whatever gaps that they're addressing are being either addressed by them or by some other party, and that they have a very clear understanding of that. Are there questions, or are there other thoughts or other things that you feel like we didn't cover or that we should have covered?
None for me.
Everybody feel like they're ready to look at assessments?
Yes, sir.
All right. John, you have anything you want to add or throw in?
No, I don't think it's not a terribly complicated component of the application, but it remains an important element and ingredient in doing an accurate and good assessment and then being able to document it. So you're looking for evidence of that in the application. Some of you have reviewed applications. What kinds of things do you recall seeing around intake and assessment? Is there anything that you recall from the applications you might have reviewed?
This is David, Minnesota. For the most part, I think that the intake and assessment aspect of the grant applications submissions, I really think that the majority of applicants do well with this part of the process. It's been rare that somebody does poorly, and if they do poorly on that, the entire grant submission is usually a really low-scoring submission overall. And
right. So if they do a poor job on this part, it's sort of going to tell you about how it might tell you that the rest of the application may be problematic. But
yeah.
One of the things that HRP is criticized about historically over the years is that we cherry pick. We pick the veterans that are easiest to serve. But we're faced with the reality that we have to help these folks find employment. And we have to do it in less than 12 months. That's a tough job. It's arguably the toughest job in all of case management. So that said, we do expect the grantees to do a really good job of determining who's going to have the best job of achieving employment. Now, as we get closer and closer to zero, the veterans are going to be harder and harder to serve. So this element of the grading criteria will become more and more important because we're going to find out who knows how to really deal with serious barriers to employment. Who can assess serious barriers to employment, determine a proper course of action, write a individualized employment plan, if you will, and then carry it out, and then these veterans go on to achieve meaningful, sustainable employment. Dave is right. Up until now, there hasn't been much of a challenge for a grant writer to write a good grant submission and do well on these points. But and I don't think it's really going to knock a lot of people out of the park this year, but certainly going forward in 2016, 2017, and 2018, when we're dealing with veterans who have a lot of barriers to employment that make them quite not fit for job readiness, we're going to see a much more of an impact with this element of the applications and in the grading criteria. That's just my comment. Sorry.
That's a good comment, Ken, and I think actually, as we're seeing in other programs, there's an increase in the veterans who are at risk of homelessness being identified, and while that's and that's true, because we're getting more responsive to things before everything falls apart, so to speak. So, and the issue with that kind of a veteran is not only does it require the kind of creativity that Ken was just talking about with a veteran who may have lots of challenges. It's to be nimble and quick and prompt and ready to go with veterans who are at risk, because you're trying to help them earn income or get income in place before they actually become homeless. And then that would be the whole idea of trying to move rapidly and quickly with an employment intervention. So you might see applicants, it might be a little premature, but you might start to see that in some, because there's been such a reduction in the number of veterans who were literally homeless. So be mindful of that too, and that's not a bad thing. I mean, that's it's not neglectful of the veterans who are literally homeless. It just is in communities the balance of those two subpopulations is shifting. Bailey, does that make sense to you from what you're hearing from your members?
Yeah, that makes a lot of sense. It's something that we're seeing pretty consistently, and I'm sure you guys are seeing it out in the field with your programs, that in some communities, they had a strong need for the program, when they first applied, and now here they are, they finished their 4th year, and they're considering reapplying, and the need just isn't there. And we'll talk about that a little bit on Wednesday, because your best sources of data for these programs is going to be their point in time counts for the numbers of veterans who would be potentially eligible. But as I'm sure you hear from programs, sometimes they'll say, well, the point in time count is not accurate. We're seeing more veterans than the point in time count shows. But that's our most reliable data source. So it's a good thing. It's good news that the number of veterans who are homeless, that those numbers are going down. Right. But that means that some organizations are having to make that tough choice between continue with a program because it's a consistent source of funding and do the right thing for the veterans that are in their communities. So we're seeing that at NCHV on a bigger level with a lot of programs that are kind of retooling how they look at services. And I'm sure that for HVRP, you're going to see some programs that have been doing this for a long time that may choose not to continue in future years. And like John said, that it's a good thing in a lot of places.
And it's also the as the homeless veteran situation evolves, the newer grantee or the grantees that are coming on board now and in the next few years are going to have to be more responsive to the younger veteran and women veterans, as Ian pointed out this morning, that the growing number of women veterans is going to require programs to look differently than they looked 10 years ago or 8 years ago or 5 years ago even. So be mindful of that too, especially if they give you demographics that describe a higher female or a higher younger veteran count.
Hey guys, we may start to see some applications that assess for supported employment. Assess the veterans who are severely impaired and may need supported employment practices. Could you give them just a brief, if not 5 to 10 minute overview of what supported employment practices are?
Sure. Supported employment is a pretty well-researched employment intervention that is been demonstrated in experimental research projects to show effectiveness with a population that has behavioral health conditions and personal challenges, including even TBI and PTSD. So it's an employment service that works with those who are committed and interested in wanting to go to work and who meet other program eligibility criteria, but they are not designed to cream or to take the most job ready. they are expected to provide a level of support that's far more intensive than what we mean by support, like in a WIA program, for example, or WOIA program. That is, the intensity of support can include one-on-one support on the job or around the job site and working with an individual very closely. A caseload of an employment specialist would be somewhere between 20 and 25 job seekers or newly employed individuals. So the caseloads are pretty modest, but the expectations are a fairly robust connection and support. So it goes, the more traditional approach is a train-in-place kind of model. This is supported employment is more of a place-and-train kind of model. Both, even though both models are driven by the job seeker's choice for the kind of work that they want to do, as well as the demands for certain kinds of labor by employers, they just have a different strategy for going about the placement and support for the individual.
Another thing that supported employment has is it's supposed to be about the rapid job search. It shouldn't take forever for a person to get out and start talking to employers. It should happen fairly quick. So there's a lot of pressure on the staff to have some relationships with employers, so that when a person does say, I'm ready for employment, they don't just, they're not just sitting around waiting for months to talk to an employer. They're getting out talking to employers is fairly quick.
And I think that's an important nuance, because you might hear supported employment and automatically think, well, isn't that kind of like CWT, the compensated work therapy, or even what Voc Rehab does within VA with VR&E. But it is different. Like Pat said, it's employment first. And I think some of our HVRP programs, they employ some of the principles of supported employment. They wouldn't have like full fidelity with all of the principles, because like John mentioned, a caseload of 20 to 25 isn't realistic for HVRP. Most of them have caseloads that are much higher, but there are some components of supported employment interventions that they can employ, things like involving the family right from the beginning, so they can identify different employment opportunities or barriers that the person might have, working with those individuals with serious compounding disabling conditions where work really does come first. There's no sheltered workshops. It's competitive wage employment. So there are a lot of overlaps with what HVRP would do anyway. Like I said, it's not, most of the programs aren't going to have full fidelity to that supported employment model, but you would want to see, especially if they're an agency that that has a supported employment, maybe like sector within their organization, that they're outlining how they make those referrals. Just like we were talking about earlier, you've got this younger veteran population that we're seeing within the homeless services system, but you also do have that harder to serve aging veteran with really serious compounding disabling conditions, and HVRP is serving both. That middle area of individuals with disabilities, but they're servable. They want to go back to work. Who HVRP has traditionally served, those are few and far between now. And so who they're serving, looks much different than it did even 2 or 3 years ago.
You might see, I think in terms of an ideal applicant for HVRP is the kinds of connections that they have to meet the various needs of veterans that come to them. So, Goodwill, for example, often, or Easter Seals, or similar organizations usually have some kind of supported employment program, and if they talk about that in their application, that they have a way to help the veteran who requires more support than HVRP can provide, if they have access to a supported employment program that's funded with resources outside of HVRP. That's the kind of ideal kind of coordination. if it's done within the same organization or if it's done through a partnership, would be fine. But as we more and more we do this work, and there are lots of veterans who are coming to HVRPs whose needs may be greater than HVRP can serve, but we certainly would like the HVRP to try to link that veteran to the right service match, even if it's not an HVRP. But supported employment can be very critical in the mix, especially as this landscape is unfolding, and especially with veterans who have TBI or PTSD.
One other quick note on it too, and I know we're over time. I don't want to keep you guys too long, but one of the pieces that's crucial with a lot of supported employment programs is that connection with the mental health treatment services. And a lot of our HVRP programs are not mental health providers, but a lot of the SSVF grantees have some capacity as core service agencies offering mental health services, either Medicare or Medicaid reimbursement. So they might have that as their foundation. So if you have an organization that is applying for HVRP and also has SSVF, they might have that possibility to be even more connected with the mental health treatment of the veterans that are in their programs. That hasn't always been a strength of many HVRP grantees, but I think that's grown in the last couple of years with some of the ones we've seen.
Hey guys, this is very, very good. Just to kind of wrap this up a little bit, going forward, and that was a very good explanation of supported employment. That's very good, because there may be some applications that do assessments and determine that the veterans are mentally challenged or have TBI or some other serious barriers to employment, and may try to write into their applications that they're going to employ supported employment practices. But I'd like to see going in the future, and this is another discussion when we get to job placement strategies, I'd like to hear you discuss evidence-based supported employment practices. Okay? All right, thanks, guys.
All right, great. Thank you. Have a good afternoon, everyone. We'll talk to you on Wednesday.
Okay, bye-bye.
Bye.
Bye.